femoral artery.
Lower limb.
Yeah, but it's not complete.
From
so
the midpoint.
femoral artery, just this is inguinal ligament. So midpoint of the inguinal ligament, and then the adductor tubercle. Okay, we draw a line.
Then the upper two-thirds.
Okay? Yeah, then upper two-third is the
Femoral.
femoral. Why upper two-third? You remember the popliteal fossa. This is popliteal fossa.
Yes.
So up to this, this is the apex. Yeah, you see here this is popliteal fossa. So up to this, okay? Because at the upper border of the popliteal fossa, then it bifurcates. Okay? So this is, we call it apex of the popliteal fossa. Up to this, the femoral artery end. Then here it divides into two artery. No, artery.
No, arteries.
Tibial and
The popliteal will divide into
No, yeah, here anterior and posterior tibial artery. Artery is anterior and posterior tibial artery.
this is the continuation of the femoral artery, the popliteal artery.
Sorry, first the popliteal artery. Yeah, no, first the popliteal artery. So femoral artery, then these upper apex up to the lower apex.
Popliteal.
Popliteal. This is popliteal. Okay. So this is the upper part of the popliteal fossa. This is the lower part of the popliteal fossa.
Just bring it up, please.
Maybe other one, because that is ligament. Yeah. That is ligament, so yeah, not here.
So the beginning 2/3 is the femoral. Okay.
Then from upper part of the popliteal fossa up to the lower part of the popliteal fossa, this is popliteal artery.
لا شفتي هذا الخطين اثنين هنا في نقطة
Yeah, here upper end. Okay. It's apex because it's a quadrangular. You remember how is it draw? It like this. Okay, so it's upper part apex and lower part apex. Okay, because here two head of the gastrocnemius. Here you remember medially semimembranosus, semitendinosus, laterally biceps femoris. You remember? So it's a quadrangular. So this is upper apex. This is lower apex. So up to this popliteal. So the lower end of the popliteal fossa, then it divides into anterior and posterior tibial artery. So anterior tibial artery, it goes anteriorly from here. Here, if we draw a line from the medial malleolus up to the lateral malleolus, then the midpoint of the malleolar line. Okay. If we draw a line from the medial malleolus up to the lateral malleolus, then midpoint of the malleolar line.
Is the
Anterior tibial artery. Okay. And posterior tibial artery from the same point. Here, just you know this is anterior, so tendocalcaneus is here. So just we can tell slightly behind the medial malleolus, or in between tendocalcaneus and medial malleolus. Because tendocalcaneus, you can feel it in your body, the longest tendon. So medial malleolus also you can feel it because it's very prominent in your leg. So the midway in between this tendocalcaneus and medial malleolus. Okay, that is the posterior tibial artery. Now nerve. So first sciatic nerve. So posterior sciatic nerve. You see, this is ischial tuberosity. This is greater trochanter. So if you draw a line like this, okay, then the midpoint of the line along ischial tuberosity and greater trochanter, sciatic nerve. Then sciatic nerve, it just come at the level of the apex of the popliteal fossa. Okay, nerve divides upper part of the fossa, but artery you see from here to here, it popliteal, then divide. Okay.
Can you please repeat?
So from this midpoint, this line, then up to the apex of the popliteal fossa, up to this sciatic nerve. Then it divides into tibial and common peroneal. So common peroneal we finish from upper end of the popliteal fossa up to the neck of the fibula. Sorry. So from the common fibular from here to here. So from the upper end of the popliteal fossa up to the neck of the fibula. This is common peroneal. Okay, and tibial from this upper point of the popliteal fossa up to the popliteal posterior tibial artery. You remember? So it's behind the medial malleolus or midway between the medial malleolus and the tendocalcaneus along the posterior tibial artery. Remember? So this is the tibial nerve. And here just only inguinal ligament. Okay. So do I miss anything? Common peroneal, I told you. Yeah.
the fibular neck.
Yeah. So I
Does
told you.
not continue class.
Sorry.
It finishes there.
Common peroneal? No, common peroneal again divide into, you remember, superficial and deep peroneal. But superficial and deep peroneal we do not need for surface anatomy. That's why I just told the apex, upper border of the popliteal fossa up to the neck of the fibula. This is common peroneal. Now just only lymph node. So you see here, this is inguinal ligament. Yes. So just along the ligament, this is the horizontal groove. Okay. And just vertical to it, that is the vertical groove. Okay. And this lymph node, any infection of the lower limb, you can easily palpate the things. Or even sometimes in external genitalia, if there is infection there, you can palpate this thing, lymph node, because this lymph node is at the time it's enlarged.
The medial side of the thigh, right? The vertical.
Just inguinal ligament, you can feel it, that you remember there is a crease or there is a fold in between thigh and the abdomen. So at that level, okay, you can palpate it if it is enlarged. Both the groups, this horizontal group as well as the vertical group. Okay. Yeah, that's it.
Thank you.
You're welcome.